This video has been made uh, to give some idea about the heart in humans. That the heart is situated in this thoracic cavity. This is the right lung, this is the left lung, and when these lungs are everted, we see this heart in its bag. The bag is called the pericardium. Here we are seeing the thymus gland present in the thoracic cavity. This pericardium, when we remove this, when pericardium is removed, there would be this structure seen of the heart. The heart having, this is the anterior view of the heart. In this anterior view, the right border, the left border, and this inferior border. The right border is made up of this right atrium. The inferior border has mainly the right ventricle and the left side made by the left ventricle. This is left ventricle, this is right ventricle, and this is the apex of the heart. Here we are seeing there are three major vessels seen. This is the superior vena cava opening into the right atrium. This is the aorta, arch of aorta originating from the left ventricle, and here directly we are seeing the pulmonary tongue opening from the right ventricle. If the heart is to be seen from the inferior surface, where we have in this diagram, in this picture, the heart has been pulled up from its inferior surface. This is diaphragm, right? So there are both the ventricles are in contact with this diaphragm. This will be the right ventricle, this will be the left ventricle pulled up from its surface. So from the underneath, like as we are seeing the heart from the down, that this is diaphragm. So diaphragm, all from its four chambers are being seen. That this is the right ventricle, this is the left ventricle with this coronary sinus. This is the left atrium, right ventricle. So this opening, which is from the diaphragm, is of the inferior vena cava. There are four pulmonary veins which are opening into this left atrium. If we open the right atrium, the right atrium has an appendage called the right auricle. This is right auricle. The right atrium has been opened to see its muscles. Its muscles are like a comb, so these are called pectinate muscles. There are opening of the three veins, that is this superior vena cava from above, inferior vena cava from below, and the coronary sinus, which is carrying the blood from the heart. The veins inferior vena cava, the blood can move back, so it is to be prevented by a wall. So wall is present in inferior vena cava is called the Eustachian wall. The wall in the coronary sinus opening is called the Thebasian wall. And another structure you see in this inner side of this right atrium is this fossa. This depression is called the fossa ovalis. This is the after before birth there was an opening in this region called foramen ovale, which is been obliterated after birth, so there remains a depression, that is fossa ovalis. In the right ventricle, the muscles of the right ventricle are more stronger than the right atrium, and here they are called the trabeculae carni. Some muscles of trabeculae carni are continuous, are called papillary muscles, which at the other end have the attachment to this tendon called chordae tendineae. The chordae tendineae On the one side they are attached to the papillary muscle, on the other side they are attached to this atrioventricular wall. There are three cusps on the right side, so it is tricuspid wall, and here you see the walls with attached chordae to the papillary muscles. When the muscle will contract, this will move down and the blood will flow from right atrium to right ventricle. But when right ventricle will contract, it will push the blood into the pulmonary trunk through these three cuspid semilunar walls, pulmonary wall. And during this pushing of the blood, this cusp will get closed and they will not move towards they will not open on the other side because these are attached with this tendon. Here the wall of the right ventricle, if compared with the left ventricle, left ventricle has much thicker wall. Here we are seeing again these papillary muscles attached with this mitral wall. Mitral wall is two cusps, so it is bicuspid, and here we are seeing the muscle of the heart is myocardium. The inner layer is called endocardium and outer layer is called epicardium. So in the left atrium there is the opening of the four pulmonary veins which are bringing the blood from the lungs. Here we are seeing the actual why it is called cuspid wall, because we are seeing they are like the cusp of the tooth. So it is tricuspid wall on the right side and the mitral wall on the left side. Mitral wall is bicuspid. The pulmonary wall and the aortic wall, they both are tricuspid, but these walls are semilunar in shape. So these are semilunar walls. After this, I want to show about the blood supply of the heart, which is coronary arteries. From this aorta arises two arteries. One is the right coronary artery, second is the left coronary artery. This is view from the anterior view that you are seeing from front. This is right coronary arteries going between the line on the epicardial surface, that is, and it is between the right atrium and right ventricle. It is going like this downward and down, then behind and back. So if you continue to see this right coronary artery, which has given here it has given the branch called the right marginal artery. This right coronary artery will supply this right atrium and right ventricle first. This marginal artery you will see again this from the behind. This is from the behind, from the diaphragmatic surface. From diaphragmatic surface we are seeing that the right coronary artery has come from front and is continuing as a posterior because it is posterior. It is descending, so it is posterior descending artery. This will supply the posterior part of the intermuscular septum, and then again continuing to supply further part of the left ventricle. If we see the left coronary artery, the left coronary artery gives one major branch which is coming down, so it is descending. It is anteriorly present, so it is left anterior descending artery, which is going to supply this anterior part of the interventricular septum and then also supplying the left ventricle. This is continuing. Next branch of the left coronary artery is the circumflex artery. This you are seeing the circumflex artery which is moving around this in between the left atrium and left ventricle, because it is moving around, so it is circumflex artery. This circumflex artery, when we see from the undersurface, this is giving the branches to the left ventricle. Coming to venous supply, the veins which are these blue veins which are going towards away from taking the deoxygenated blood from the heart muscles. again are on the left side and the right side. All these veins are congregated to make a one big coronary sinus located on the left, between the left atrium and left ventricle. This coronary sinus. This coronary sinus will open into the right atrium because it's carrying deoxygenated blood. It's carrying the from deoxygenated blood from the heart and is putting it into this right atrium. So this structure, I hope, make the things clearer to you about the. Here one more structure diagram is here. You have seen there are two major supplies to the heart, nerve supply to the heart. So one is this major thick nerve, which is the vagus nerve, which is carrying the sympathetic, is carrying the parasympathetic nerve supply. So to reduce the heart rate, to reduce the contraction of the heart, and then these parasympathetic nerve supply, the sympathetic nerve supply to increase the heart rate. So this heart has the nerve supply both sympathetic as well as parasympathetic. Right? Thank you.